My name is Julia Bueno, and I'm a counsellor and psychotherapist. And I have a particular interest and experience of working with women and couples who may have experienced pregnancy loss or struggled with their fertility. Counselling is a type of talking treatment or talking therapy that can help people learn ways to cope with their emotional difficulties. It can be individual, so you'd go and see a counsellor on your own, or you might go as a couple. Any good counsellor should be able to help you find strategies or ways of coping better with the difficult feelings that you have. Whether it's something in addition to the support that you have around you, and certainly in the case if you don't have any support, it can be really valuable. I would also say that counselling can be of critical importance if you really feel you can't deal with your feelings and you can't go on at all. In the NHS, it's usually counselling that's offered in quite a short-term basis, a set number of sessions. And you might well have heard of CBT that is commonly offered, and that's a very typical type of counselling. You might also have heard of the term psychotherapy. I'm a psychotherapist too, and it's very similar to counselling, but tends to be kind of longer-term work and tends to work more at understanding the kind of deeper issues behind what might have brought you to counselling. Miscarriage is a very upsetting experience, and it's very usual to feel anxious or low. And of course, it's a very real bereavement for a lot of people, and grief can take time to ease. It's also usual to experience sort of unwanted and unpleasant thoughts and to experience unpleasant memories. These might not settle down on their own, or they might not settle down with the support that you've got. And it might be that these feelings and these thoughts are beginning to get in the way of things. It may be that you're finding it very difficult to sleep or even eat and be lacking in motivation to do a lot. That's all very usual. But it may hit the point that that it all gets too much and the support that you have around you and your self-help strategies are just not working. And I would say that would be a good point to consider getting some professional help. Miscarriage doesn't always happen in isolation, so it might happen at a particularly vulnerable time in your life. And also what can happen is that it can evoke some difficult feelings from the past. Maybe you've had previous bereavements that haven't been resolved. And again, that might be the time to seek professional help. I would suggest that if you've miscarried in hospital, if it's not been suggested to you by a doctor or nurse, that the early pregnancy unit might well have a counselling service or a perinatal bereavement team. That isn't always the case. Other sources of counselling might be through your GP, through your employer, or maybe even your place of study. But often there are long waiting lists, and I often hear people waiting for months. So you might be left to your own devices to find a private counsellor. Of course, private counselling is costly, but it is possible to get reduced cost counselling. Some counsellors will advertise that, but even if they don't, I'd suggest it's worth seeing if you can negotiate. There are also low-cost counselling services out there, some of which are specialists in pregnancy loss, and training organisations. Those are another possible source of low-cost counselling, with counsellors who are in the later stages of training. I think it's a good idea to ask around for word-of-mouth recommendations, but quite often people go online to have a look, and private counsellors will tend to have their own websites and will advertise themselves online. That can be quite overwhelming and confusing, again, because of the different terms and types, but there are so many to choose between. Professional bodies such as the British Association of Counselling and Psychotherapy, BACP, will have a register online where they have search facilities that make it quite easy to find counsellors, maybe through your postcode, where you live or where you work, or through the gender of a counsellor. Maybe you particularly want to work with a woman. And indeed, some counsellors might have a specialist interest in pregnancy loss. I also recommend a platform called welldoing.org that has a database of qualified and registered counsellors, but has a questionnaire that once you fill in will do some of the work for you and help match you up with a suitable counsellor. What we do know about counselling is that it works best if you get on with your counsellor and you feel really safe and comfortable to talk with him and her. So it might mean that you end up meeting more than one counsellor until you find the right fit. So as a counsellor myself, I'm not in the slightest bit offended if I meet someone and they don't want to come back and meet me again. It's within your rights to decide who you want to work with. The usual process is to meet with a counsellor initially, and that would be a time where a counsellor will ask you quite a few questions about yourself, your background, what's been going on, and of course, what brought you to the counselling in the first place. It's also an opportunity for both of you to make a plan about what you will look at in the sessions ahead. And it's a chance for you to check out your counsellor and to feel comfortable with him or her, because that's very important. It might be that your counsellor says something that upsets you, or you feel that he or she didn't quite get you. I would encourage you to talk about that, and it might well be that when you explain things further, that helps the relationship and even helps the counselling along. Every miscarriage is different, and a counsellor needs to understand yours as best as he or she can. It might well be that your counsellor doesn't have much experience in pregnancy loss, but any good counsellor will have plenty of experience in working with the feelings that go around that. Of course, if you really don't feel comfortable and you really feel that you can't work things through, then it's within your rights to stop the counselling. I mean, that can take a bit of courage, but it's worth it. Sometimes I say to people that if you go to a gym and you don't like it, it's not for you, you don't give up on going to the gym. You'll find another one that works for you. And the same will apply to counselling. It might be that you decide that counselling isn't for you, either now or ever, and that's okay too. There are plenty of other sources of support that can be really effective as well, and the Miscarriage Association has plenty of ideas as to where to find those too.